submandibular salivary gland. The submandibular salivary gland is a mixed type of gland. The location, it is located mainly in the anterior part of the digastric triangle and partly in the undercover of mandible. The next one, that is the parts of submandibular gland. The submandibular gland is divided into two parts, a large superficial part and a small deep part. The large superficial part, which is located below the mylohyoid muscle, and it fills the digastric triangle. And the small deep part, which is located above the mylohyoid muscle. The two parts are continuous with each other on the posterior margin of the mylohyoid muscle. The next one, the facial capsule or coverings. The investing layer of deep cervical fascia split to enclose the submandibular salivary gland. The investing layer of deep cervical fascia that have a two lamina, the superficial lamina and a deep lamina. The superficial lamina that is attached into the base of mandible and the deep lamina that is attached into the mylohyoid line. That's all about the coverings or the capsule of the submandibular salivary gland. The next one, the relations of the superficial part of the gland. The superficial part of the gland has three surfaces: the superficial or inferior surfaces, lateral surface and medial surface. The posterior end of the gland that is contact with the ligament that is called as a stylomandibular ligament that is separate the parotid gland from the submandibular salivary gland. Then the superficial surface that is related by the first of all the skin. Just below the skin there is present a superficial fascia that contain the platysma and the cervical marginal mandibular branch of facial nerve. The investing layer of deep cervical fascia is also present and it also contains the facial vein and submandibular lymph nodes are also present. The superficial surface are related by skin. Just below there is present a superficial fascia that contains the platysma and the cervical branch of facial nerve, then facial vein, then investing layer of deep cervical fascia and submandibular lymph node. These are the relations of the superficial or the inferior surface of the submandibular gland. The next one, the lateral surface. The lateral surface of the superficial part that is related by the submandibular fossa on the inner surface of the body of the mandible. Then it is also related by a medial pterygoid muscle and the facial artery. The next one, the medial surface. The medial surface relation that is divided into three parts: anterior part, intermediate part and posterior part. The anterior part that is related by the mylohyoid muscle, mylohyoid nerve and vessels and submental branch of facial artery. These are the relation of the anterior part of the medial surface of submandibular gland. And the intermediate part that is related by hyoglossus muscle, styloglossus muscle, lingual nerve with the submandibular ganglion, hypoglossal nerve accompanying with the two venae committents, then submandibular duct and the begin from the middle of the medial surface. The next that is related by the posterior most part that is related by stylohyoid ligament, then styloglossus muscle, then glossopharyngeal nerve, then stylopharyngeus muscle that is also related, then the middle constrictor of the pharynx. These are the relations of the medial surface of the submandibular gland. Then another one, relationship of facial artery. The facial artery that is related to the superficial part of submandibular gland twice. At first it grooves the posterior end of the gland, then it descends on the lateral surface of the gland to reaches the base of the mandible and the inferior angle of the masseter. This vascular relation is of surgical importance. Then next one, the relation of the deep part of the gland. The small deeper part of the gland that extending forward from the free margin of the mylohyoid muscle lying in the intermuscular interval. So it is related laterally by the mylohyoid muscle and medially by the hyoglossus muscle, above by the lingual nerve with the submandibular ganglion, and inferiorly by the hypoglossal nerve. So this is all about the relation of the deep part. Medially hyoglossus muscle, laterally mylohyoid muscle, superiorly lingual nerve with the submandibular ganglion, inferiorly hypoglossal nerve with the accompanying veins. The next one, that is the submandibular duct or Watson's duct. The submandibular duct is about 5 cm long. It emerges from the anterior end of the deep part of the gland and it runs forward on the deep surface of the hyoglossus muscle between the lingual nerve above and hypoglossal nerve below. At the anterior margin of the hyoglossus, the lingual, this one is the anterior margin of hyoglossus. The anterior margin of the hyoglossus muscle, the lingual nerve crosses the duct from lateral to medial side. And then it turns upward above the sublingual salivary gland. Then it opens into the floor of the mouth at the summit of the sublingual papillae on either side of the frenulum of the tongue. The duct can be palpated in the floor of the mouth. It is the narrowest part in the orifice by which it opens into the oral cavity. So that's all about the submandibular duct or Watson's duct. The next one, that is the secretomotor nerve supply. The secretomotor nerve supply, that is have parasympathetic, the preganglionic parasympathetic fibers that is origin from the superior salivatory nucleus in the pons. They travel through the facial nerve and it leaves the facial nerve and it carry through the chordae tympani nerve. This chordae tympani nerve later joins with the lingual nerve in the infratemporal fossa. The lingual nerve brings the preganglionic fibers to the submandibular ganglion. That's which is the peripheral parasympathetic ganglion. The postganglionic fibers is arising from the submandibular ganglion and it is supply for the submandibular gland. That's a secretomotor innervation. That is a parasympathetic supply. The sympathetic supply, that the preganglionic fibers is origin from the T1 spinal segment of the spinal cord. Then it is relay in the superior cervical sympathetic ganglion. The postganglionic fibers is arising from the superior cervical ganglion and the sympathetic plexus winds around the facial artery. It is passing through the submandibular ganglion without relay and it is supply for the vasomotor relation to the submandibular gland and the sublingual gland. Then next one, the sensory supply, that is through the lingual nerve. That's all about the nerve supply. The lymphatic drainage of the gland, the submandibular lymph node. The blood supply of the submandibular gland, that is through the sublingual and submental arteries and drained by the common facial vein and the lingual vein. Then last one, the applied anatomy or the clinical highlights of the submandibular gland. The salivary canaliculae occurs in submandibular duct due to the stasis of the secretion. The gland swells during eating when the stone block the duct. The second one, the submandibular salivary gland is usually removed because of the calculi or the tumor. So that's all about the